Hi, I'm Dr. M.S. Kanwar from Indraprastha Apollo Hospital, New Delhi. I'm in the Department of Pulmonary Critical Care and Sleep Medicine as Senior Consultant and Advisor. We are all aware that in the second wave, the severity of the disease and the transmissibility of the disease was very high. In fact, there was a fourfold increase or the surge in new cases in the second wave as compared to the first one. And also, the severity of the disease was higher to the extent that the overall mortality rate was higher in the second wave as compared to the first one. If I remember correctly, the overall mortality in the first wave was somewhere around 1.2%, but it rose to some like 1.8% or a little higher, close to 2% in the second wave. And the symptoms were by and large similar to the first wave, except that the severity was much more. People became hypoxic, means they dropped their oxygen much faster at a much more rapid pace. It was not like the first week or the second week like in the first wave. In the second wave, the disease could progress from second, third, fourth day so rapidly that the patient could be on oxygen by day 3 or day 4 or day 5 and could be hospitalized by third or fourth day and could be in the ICU by fourth or fifth day. So that was the extent of the damage and the severity it ferociously brought into our system, body, especially our lungs. There were a lot of other complications also besides just attacking the lungs in the beginning. The myocardial inflammation was also seen more this time, and the long COVID symptoms which went on and are still persisting in large number of patients has been far more prominent in the second wave as compared to the first wave. People with tiredness, fatigue, weakness, cough going on, some vague chest pains, some fever coming and going, and breathlessness coming and going, sometimes headache and vertigo, giddiness. These kind of symptoms have been seen. Some people have erectile dysfunction. In women, there have been obstetric problems, a few gynecological problems also, but more obstetric problems. And hair loss has been very commonly seen, and it has been there has been influx of patients coming with hair loss problems. So these are all the situations we are facing after the second wave, and we saw them after first wave also, but much more prominently after the second wave of COVID.